Welcome to Sage Sisters. We are sisters, besties, moms, and co-founders having a fun catch-up on parenting and life.
Hey, I'm Ann.
And I'm Kate. Welcome to the Sage Sisters podcast.
This is a fun one today. Do you want to tease the topic today, since technically our guest is my great friend as well through you, but your best friend. So why don't you introduce?
Yes, my bestie from undergrad. So we have been friends for 25 years. Is out here visiting me. She's an incredible dermatologist. And so Ann and I will take all of the questions that we typically would just sideline her with and bring it onto the pod, since we know many of you have the same question. So we'll get Dr. Lori Sanford on here in a bit and ask her all of our skincare questions. So that should be fun. But before we get there,
this one will run long just because we have so many questions.
I know. I was like, even if I took everything I've asked her over the last 3 days and put it on here, we'd have an hour-long segment. So,
all right.
Before we get to there, though, what's your high?
My high is that we took the kids swimming yesterday, and it's just getting me so excited for this season. I keep saying, like, the weather being nicer, all of this stuff gets me excited, but I've been rucking outside. We went swimming with the kids.
You went outside. It's warm enough.
Yes, it's warm enough. Now, we did like an indoor kind of outdoor pool situation, but it's just it's there, and it's getting me
summer vibes. Baby.
And I also have been thinking about summer, because you know how you have to plan camps so far in advance. And I feel like I've crushed our summer agenda.
Ooh, I feel jealous of that. As soon as you said that, I was like, oh, I don't feel the same yet.
I set up a bunch of camps. I had a couple like fun things pop up with, like, you know, different kids in the area doing something fun. So I'm like jumping on some of these local activities, and we have some trips planned with weddings, but we're also going to like extend our trip and, you know, stay in Chicago a few days, 1 week. And I don't know. I just feel like because I've had to think summer, I feel like I'm ready for it.
I'm happy for you, but also that's the kick in the pants I needed.
No, sorry. That's the opposite feeling, though, when you're not prepared and someone tells you how prepared they are.
Yeah, that's exactly how I did. Gulp.
All right, well, we'll move on then to not make you feel worse. What's your high?
Okay. Well, Lori's visiting with her family, and it's just been a great weekend. You know, these friends that it's so easy because you have so much lived experience with.
Yes.
We've been close since we were 18, and it's just
half your life.
I've lived
more than half of your life.
More than half my life. So anyways, it's just been so easy. She's got a 12, 10, and 8-year-old. So just to see the kids play together, and we've done a bunch of fun stuff, and I don't know, just like good fuel for the soul.
Well, I'm so excited Lori's going to join the pod today. I love her. She's got good vibes, and she's a wealth of knowledge.
I know. A wealth of knowledge and Botox.
Exactly.
Trademark.
Exactly.
All right, cool. What's your low?
Well, you know what? It kind of goes with this. I'm going to lead off. I have a couple lows I could rattle off quickly, but one is I'm so frustrated with everyone being so busy, and it's really hard to keep up with adult friendships. We talk about this a lot, but I've been trying to plan a couple girls' nights, and it's like, we'll see you in 2 months. We joke about this all the time. But also, I do feel like, especially in newer friendships, it's hard. You know, you want to make sure they're on the same page too, and it almost has to be said. Like, we may not see each other all the time, but the second we see each other, it's like nothing's changed. You know, you almost have to give people grace because all of our schedules are crazy. So it's a little bit of a low.
We're just overbooking, though. There's no space.
No, and it's like kid overbooking, adult overbooking. Everybody's schedule is crazy, and like, even I
feel like it's mostly kid overbooking. I feel like it's the
work,
practice
like when
every
people
day.
have to work and travel and all the things too.
Yeah.
And even my chillest friends feel like overwhelmed right now with how much they have on their plate. And I hate that for them because I know that feeling so well.
Did you read my low? Is that what got you to
what's your low? I didn't read it.
I feel very overwhelmed.
Stop it.
Yeah.
Well, but I will save the rest of my lows. How about that? One is our HVAC might be broken. We might have to pay for a huge home fix.
What's that cost?
Probably no less than $10,000 if you replace your HVAC.
Brutes.
But that might be minimum, like low minimum. So hopefully
Okay.
that won't go down.
Godspeed.
But anyways, that's all I have. Go to your low so we can talk about you being overwhelmed.
Well, no, I just like everything you were saying like resonated.
Yeah.
I feel part of it is I have to travel this week and I wasn't planning on traveling this week. So then everything that was booked for 3 days now shuffled.
Yeah.
That feeling is just a bit uneasy.
Mhm.
I don't mind traveling, but I booked this trip last week
Yeah.
because something came up. The good news is I'll get to see you. Will be some bright spots. I know once I'm there, it will be lovely. But I had 3 days of booked things that then now I feel scrambly about. And like Chris now has to pick up this, and now I'm scheduling a complicated childcare pickup drop off scenario here, and just ugh.
Yeah.
And then some of that's work, and some of that, I had a good friend, and we had a birthday dinner planned for her Wednesday. Well, now I'm gone. So then I was
Trying to
scrambling to find a
reschedule.
new time and trying to coordinate that because I don't want to let her down just because I have to travel now.
Yeah.
And then I must have missed it, or maybe the comms came out late, but sign up for the spring like after school enrichment classes was today. And I feel like I haven't even talked to the kids about it, but they fill up quick. So I'm like,
Yeah.
fuck, should I like guess? I don't know.
I would just
or
guess.
now they'll hate everything. Yeah, because otherwise they'll be
Yeah.
gone.
You got to guess.
And then to your point, I'm feeling behind for my summer, partially because like I need to find someone to help drive the kids around because they have swim team stuff. And I haven't done the things needed to find that person.
I want to be clear. I have good plans booked, but logistics will still be hard. I haven't like made my life super easy, but we have a lot of kid activities.
I got lots of time. And then it's like, no, you got 2 months, really. Yeah. And I'm like, oh my God, 2 months, that's 8 weeks. That's not enough time to get all this stuff organized.
Yeah. Especially if you're hiring somebody to help you shuffle kids around. That's a whole thing.
I know. So I'm going to but then I'm like traveling this week. So I'm like, okay, next week I'm going to like block time to like make the exact thing that I want and like get it where I need to and like hope the universe delivers the right person to my lap. But I don't know. I just, this feeling, I'm just like, oh God, I feel a little underwater.
Well, I also have been feeling split. We have multiple kids and everybody has different activities. And I feel like a lot of our family time is split now. It's like you go with said kid and I'll go with other kid and we'll meet in the middle. And it's just like, I kind of like it when we're a unit. And it feels more fun, even on the weekend activities.
Is that just because Lola's sports are picking up, or like how did you?
Well, yeah, Lola.
What's different?
Just activities, Girl Scouts, sports, different things, and then we have longer baseball days and things like that. So it's just really hard to do both now together. So we just try to go back. Well, and
I do. Part of it's just the age of the kid, and part of it's like anytime they play something like a little more competitively, it's so intense.
Yeah. Well, and it's like I don't want the girls to feel like they can't do everything no matter what it is when Ace doesn't take priority just because he has more games or a tournament or something, so we have to kind of like do the back and forth. But I will say this weekend I got baseball and it was quite delightful. I got a solo time with Ace in the car and all day took him to the sports things. And it was kind of a fun because I'm usually with the girls.
Do you have a couple of friends there?
I really like some of the moms. So now
that helps a ton. I found.
Totally. So it was fun. And, being outside and watching baseball all day is actually enjoyable when you don't have to entertain 2 little ones, to be honest with you.
Totally.
It's like, oh, I just sit here and like enjoy and actually watch the game fully. And,
I had like a bad mom thought, which is like, could I bring my Kindle? And then I was like, maybe I should pay attention. But I was thinking, man, that sounds nice if I could like read a little bit. Because there's a lot of downtime.
People were reading in between games. Parents were reading in between games. Okay. So,
all right.
Yeah, I don't know.
All right. Well, should we move into our Everything's Not Awful segment?
Yeah, let's do it. I love it. Everything's Not Awful.
Everything's not awful. This story brought me to quick tears, which, there's a lot of things that could bring me to quick tears. A sports story, but this one got me. There was a college student in Tennessee named Van McGuire who became paralyzed in a devastating accident. And a team of engineering students at the University of Tennessee decided to help him out by making this like really souped up wheelchair so that because he was like an outdoor guy. He like would mountain bike and hike and all this stuff. And the wheelchairs just like would not give him the accessibility that he needed. So they created this like custom whip that is so special. And just the smile on his face, you see him in it in the picture. I mean, I was just like
weeping.
Waterworks.
Oh my gosh.
But how sweet is
It's
that?
so cool.
Like using their talents to like help this kid? That's amazing.
So cool. I know. When you shared this story with me, it immediately was a tearjerker because, again, it's people helping people, but using their talents and abilities to make a better life for him is really cool. I love that.
Well, and it's like, I kind of love it when it's just like you impacted one person's life in a huge way. That's so cool.
I love that.
All right.
Good reminder. Everything is not awful. I love it. All right. So let's jump into our topic for the day and our guest.
So without further ado, I am so excited to introduce one of my best friends in the entire universe. She was my roommate at Ball State. She could blackmail me in a second. We've lived a lot of life together, and she happens to be visiting with her family. So I figured, why not leverage her for my benefit? This is bestie Dr. Lori Sanford joining us on the podcast.
Woo! Yeah. Hello.
We're pumped because Lori is a dermatologist. And what lady in their 40s doesn't need a friend who's a dermatologist? I don't know. I'm lucky gal.
Listen, I feel like I get the benefit through Kate because I still send texts to Lori like, hey, is this mole weird? Like you get so many weird texts from our family, I'm sure.
Is that just us or do all of your friends sideline you?
Almost
like that?
all of them, but it's well received. It's well received.
Perfect.
You don't mind like the weird. I bet your camera roll is bizarre.
It is bizarre. It is bizarre. But then you can ask for like weird favors in return. So you never know.
That's true. Well, I'm so excited because we talk about this topic on the pod without a lot of background or
expertise.
But skincare is always on our mind. And when I was talking to my husband about what we were recording today, he was so excited because he was like, can you ask about a minge regimen? Can you ask some questions? So he had questions. We were talking about just right before the podcast doing a whole section on kids and kind of when kids get to the point of needing dermatology, like acne or obviously protecting their own skin, the kids getting into the Sephora babies, like what should we do with them? What should we not? So we'll cover a lot today. So I'm very excited.
Much to discuss. Maybe, Lori, do you want to give just like a tiny background of your credentials, medical practices, all of that, just so people know you're super legit?
Sure, absolutely. So I've been in private practice just outside of Indianapolis, Indiana for the last 13 years. I did all of my training at Indiana University Medical School and did my dermatology residency there as well. In the Midwest, I treat a lot of skin cancer. So while I'm well-versed in many things, I treat acne, psoriasis, eczema, a lot of other skin conditions. One of my primary focuses is on skin cancer, and thus skin cancer prevention is super important to me. But we have to know how the skin works from the day we're born to the day we die, and what are the best ways to take care of that to maintain good skin health.
Yeah. What about the aesthetics? Are you well versed?
Yeah. So I do a day of aesthetics in my office every week to give myself a little break from the harder things in life. Things from neuromodulators like Botox, fillers, chemical peels, lasers, all of the fun pieces of skincare I also have some experience with as well.
Sweet. Let's get into it. Knuckles crack. All right. I think for me, one thing I always think about is like, am I doing enough for my skin in my 40s? Like, what should my skincare routine look like? I don't know. Maybe kick us off. Like, what do you recommend? Just like mom, somewhere between 40 and 50. Like, what are you recommending for just best in class skincare regimen?
Yeah. So I get a lot of questions in my office. What's the best skincare line? Or what are the things I have to be doing? Or, you have people come in doing 50 things and you have people coming in doing 0 things. So I think everything in moderation, and we have to pick the pieces that are probably most important. So that's maybe what we can cover a little bit on today. So when I have a patient come in and they ask, what can I do to help protect my skin, or what should I be doing on a daily basis? So of course, as someone who treats a lot of skin cancer, sunscreen comes up as a huge portion of that. So I ask that most of my patients include a daily sunscreen in their morning routine, right? We don't need to be putting sunscreen on before we go to bed, but as a base layer, it can be underneath of makeup. It can be as a part of your makeup. So a lot of CC or BB creams or foundations have SPF in them, and they should be labeled as such. So
is there an SPF number we need to be hitting?
yeah. So in general, guidelines will suggest a 30 or higher is broad enough spectrum to cover most of the UV. I prefer to be around that 50 mark, but you're wasting your money at the SPF 75, 100. You just don't need to be that high. And it actually tends to affect the elegance of the skincare products. So things at higher SPFs tend to be thicker, greasier, and really more intended for like beach use or heavy sun exposure than your day-to-day application.
So if your foundation has SPF in it, is that good enough if it's 35 or above or 50?
I think so. Yeah.
Okay. And if you are using a daily facial sunscreen, what brand or brands do you recommend? Do you have any that are your favorites?
I have a lot of patients with pretty sensitive skin. And also people don't need to spend a lot of money on skincare products. So the basic products you can buy at your local drugstore, Cetaphil, CeraVe, Eucerin are great skincare lines to start with. Now, as you want to improve, again, the elegance of the product, these more expensive sunscreens that you get access to in Sephora or in dermatology offices, they will provide maybe better quality for the inactive ingredients, but the actual active sunscreens are pretty good, and even basic and expensive products you can get at the drugstore.
I'm going to sound like a dum-dum here because I don't know exactly what I'm talking about, but isn't there like a zinc sort of sunscreen option or like a clear one? Like, is the zinc way better, even though it like white casts and can be weird?
Yeah. So a lot of people talk about organic versus inorganic or physical versus chemical blockers. And most of the children's sunscreens actually have titanium dioxide or zinc oxide in them. And those are those physical blockers, the mineral blockers, that are thought to be safer for, pediatric populations, for more sensitive types of skin. They probably provide a little longer lasting protection. Again, they're thicker, but where I find them to be most useful are in a lot of makeup products. So they can be then tinted. And so your CC cream with an SPF of 50 probably has a zinc or titanium in them. And they work really, really well. They're in a lot of the kids' sunscreen sticks. We tend to see fewer allergies and reactions to those ingredients. So for my 10-year-old son that it gets rashy after using sunscreen on his face, I tend to choose facial sunscreens that have zinc or titanium in them. But the U.S. has pretty stringent criteria for approval of sunscreen products. So most sunscreen products are really super safe, and reapplying them is probably more important for efficacy than anything else.
I love how we haven't gotten off the first thing, which is sunscreen.
Well, I was just going to say, this is important though, because I always am questioning, am I using enough sunscreen? Which sunscreen is the best? And I have spent a lot of money on like a tinted moisturizer for my face when I don't have sensitive skin. So I could probably go down to a cheaper brand and still have a good experience. I love that.
Mm-hmm.
Absolutely.
Okay. I have a question too. All the tennis ladies that are, aging well, I mean, they have like sleeves on. But I hate playing in sleeves, and I'm sort of like, is my SPF, I'll play like in 50. Like, is that good enough? Or am I still going to get all the age spots and sun damage? And like, is it protecting sunscreen but not sun damage? Or do I need to just be sleeves?
Yeah. I think sleeves are always better, which is not the answer you probably want to hear. But that's keeping everything off. And you're not going to sweat off sleeves like you are sunscreen. There's a lot of variables that go into sunscreen application. Did I put enough on? Is it resistant to sweat and water enough? Is it a spray? Is it a lotion? So there's a lot of human error that goes into sunscreen, but you can't mess up a sleeve. It's just a lot easier. But I do think that sunscreen, when applied adequately and frequently enough, it does provide really good protection. It's just most people don't use as much or as often as they should.
Yeah.
And will it do both skin cancer protection and skin damage protection?
Correct. So when we think about
Okay.
UV rays, the SPF is basically what's protecting you from those UV rays that are damaging. So UVB is typically what we consider causing sunburns, but UVA causes DNA damage, photoaging, wrinkles, pigment change, sunspots. So that's why when they say broad spectrum, that means that the sunscreen covers for both UVA and UVB rays, which are both dangerous to us, just in different ways.
Okay, so moving away from sunscreen a little bit, on a daily routine, what else do you recommend, kind of at a minimum, for our age to do?
Yeah, sure. So I get a lot of questions about cleansers, and my professional opinion is that what you're using to wash your face comes off your face, so probably not as important. So I have my patients use what feels good on your skin. So a foaming cleanser, a creamy cleanser, a gentle cleanser, a harsher cleanser. It just depends on your skin type. So Kate and I were just talking last night that her skin is pretty sensitive and she needs a more gentle hydrating cleanser. I'm a little more oily, so I need one that foams and really removes oil, and it can be a little harsher and my skin will tolerate it. So again, cleanser is not as important the type that you're using.
What about a wipe, though? Do you hate those wipes, or are those okay? Because I'm addicted to those.
So they're fine for people whose skin can tolerate them, but they have a lot of preservatives in them, and so they can cause acne-like breakouts, rosacea, eyelid eczema. So there's a lot of preservatives in those wipes, and even ones that don't have scent to them often have either fragrance or balsam of Peru, which can cause sensitivities in patients with sensitive skin. So
those wipes F me up big time.
So an alternative I give to sensitive patients is plain Vaseline or petrolatum. Will actually remove most makeup products, especially around the eyes, and doesn't create a lot of sensitivity. So that's an option. But even things like Aquaphor, people think it's Vaseline, actually has lanolin in it. It has other pieces to it that can cause some sensitivity. So plain petrolatum is about your only super safe bet for.
And is that just petroleum jelly?
Yep.
Okay, that's good to know. I did not know that. I use Aquaphor just like it is Vaseline.
Yeah, and without a lanolin allergy, you're probably fine. But there are some people who have those sensitivities and can't.
Yeah. Okay, what about moisture?
Yeah, moisture.
Or serums.
Give me
you can get crazy into these, like hyaluronic acid, anti-aging, this, that, and the other. So for basics, I tell my patients you need to use, I actually really like retinol. So retinol is a huge portion of an anti-aging regimen. Most people should start it in their 30s. It doesn't really matter what type. So finding one that your skin likes and tolerates is great. There are prescription versions of retinol, like tretinoin, that we will prescribe in the office. But we know that all these retinols or vitamin A derivatives really help with maturity of the skin, meaning keeping the skin looking youthful. It helps exfoliate top layers, minimizes fine lines and wrinkles, and is really overall good for the skin. Again, some skin won't tolerate it. So it may be a one night a week for some people. It may be nightly for other people, but it is something that I think is important to introduce into your skincare routine as we get older.
Okay. Hypothetically speaking, if there is a 40-year-old woman who hasn't done this yet, do you...
Hypothetically, and yes, you should start now.
Yeah. Okay. And like I should work my skin up to it. So I should start once a week, and just any brand with retinol in it should work because I don't have sensitive skin.
So, your more mild retinols are available over the counter. Your friendly local dermatologist probably carries a stronger retinol, and then of course prescription products are your next step.
Is there any telehealth way to get tretinoid, or is that
you
know what I mean? Like, is there a Willow equivalent?
Yeah, not that I'm not sure which ones, but there are probably multiple options to get tretinoin.
Tretinoin, sorry. I feel like that's the best one that I keep hearing about, but
There's such a
just because
variety.
it's strong.
It's just that tretinoin is super inexpensive and broadly available. It's been around for so long. There actually is one retinoid available over the counter. So it's an equivalent or in the same class as tretinoin. It's not retinol, it's retinoid. It's called adapalene, and it's available in a variety. It used to be called Differin, was the only way it was available, but now you can get generic brands, or La Roche-Posay makes one. Amazon, I think, makes one. But adapalene is in a gel form and really was intended to be used for acne. So I hesitate sometimes for tolerability purposes to have people using it for anti-aging purposes. It can be used, especially people with more hardy skin, but that would be an option. You can get a retinoid without a prescription.
Okay. What about other, like, I know vitamin C serum I've been hearing about, or vitamin C like, worth it or not worth it?
So personally, I use a vitamin C serum most mornings. There are a lot of antioxidant serums available that have other antioxidants in them as well. The thought is that antioxidants used, especially in the morning, help protect from the free radicals or the damage that's created by pollution, sun, environmental exposures, and thought to be helpful. Vitamin C tends to be a little unstable depending on the formulation and the storage. So vitamin C is one that I would not buy past dates or from, don't grab it off the Marshall's shelf. So it's probably better, bought at your local drugstore or from your local dermatologist that has some different formulations as options for you. But I do like antioxidants. And so it's kind of my fourth step. So I think if I have to recommend things to do, it's sunscreen, retinol, moisture, and then an antioxidant are probably your 4 steps that are pretty easy to get going if you're not doing a regular skincare routine.
Anything. Okay,
go back to moisture for a second. Oh, okay.
Well, one of them was going to be moisture, so we can start there. What's your question?
Well, I was just going to say, I pay a lot for hyaluronic acid, which I like the way it makes my skin feel, but there is part of me that's like, damn, this is pricey. Is it worth it? What do you think? Are there cheaper, better alternatives? What do you think?
Yeah. So hyaluronic acid is such a big molecule. It's probably not penetrating your skin very much. It's not doing much on a deeper level, but it's probably holding some moisture on the surface of the skin. It tends to feel elegant. It's smoother with application. And so a lot of patients really like the way it looks, but it's one of those things that's going to wash off each day. So you're not getting, like, a retinol is going to change how your skin looks for years. We have studies that show you biopsy a skin that's retinol naive and then biopsy it again a year later after use of retinol. And the structure, the collagen, the proteins in the skin look different. So you're getting some long-term benefits. Hyaluronic acid, probably not going to do that, but it's going to make your skin look great that day. And it's part of some moisturizing products and it's not in others. So I think if you like it and it looks great on your skin, absolutely go for it.
And what about like a Neutrogena or just like a basic over the counter? Like I get a Costco pack of like night cream, whatever's on sale, to be honest with you. And that's what I use at night. And I think it works because it's moisturizing my skin, but is that false?
No, I think that's true. We call, night creams or moisturizers, we call them emollients. And so they are adding hydration to the surface of skin. They're preventing water loss. They're protecting from the external environment. They're basically enhancing what your skin is already supposed to be doing. It's just creating an extra layer of armor that your skin has. And so I don't think you have to have expensive creams. You can, and there are some really fabulous products out there. But I in particular don't use anything super expensive except my retinol.
What about a night cream? Like Ann said, is that like there's day cream and then there's night cream?
Typically, night is just heavier. Like it's a thicker moisturizer. It's intended to stay on for longer. You're not wearing sunscreen underneath of it, so it's just different in the formulation, if you will.
I once heard Hailey Bieber say that she likes to go to bed like a glazed donut. She puts so much cream and stuff on her face. It's like something about a moisture barrier, which just reminds me I don't know enough about this, and I'm sort of like, do I need to be looking like a glazed donut? What do you think?
Well, I think some people, if they make themselves look like a glazed donut, they're going to clog every pore on their face and then end up with acne like a teenager. So again, it depends on skin type.
Yeah.
So if you tend to be dry and not acne prone, layer what you want on there. I've seen a lot of TikToks talking about, what is it? Beef tallow is all the rage
Yes,
now.
I have that on my notes.
Yeah, but if you look at the actual like the fatty acids that make up beef tallow, it's probably not all that great for your skin. But what's happening is you take people that go from never putting any kind of moisture on their face to coating their face with beef tallow, and then suddenly their skin is looking better because they're putting something on their face. But there are better if you want to use natural.
I haven't even heard this. What are they doing?
Basically,
beef
the beef
tallow.
fat. They're putting beef fat all over their face at night, and it's curing everything on their face.
Oh, wow. Oh, gross. I can't even imagine the acne I would have. I like just shuddered thinking about
I would
it.
absolutely never put beef tallow on my face. All the power to the people that think it's a miracle cure, but I wouldn't do it.
Yeah. It's like the trend. It's like the milk bath, all the things. It's like, what next?
Okay, I'm not done asking questions. We're already 20 minutes.
Let me finish. Yeah, let me finish one question I had for clarification, which is the vitamin C. Is that the one removing dark spots? Like if you have dark spots on your face, you apply that directly to it, or what is the? Yeah. Is it vitamin? What's the vitamin for that?
What's the vitamin?
Asking for a
friend. Yeah, so vitamin C is ascorbic acid. So I guess in theory, any acid can potentially help lighten or soften dyspigmentation on the face caused by UV damage, but it's not in general what we use for dark spots on the skin. So azelaic acid, kojic acid are all really good for dark spots.
Is this over the counter or is this something you have to get through a dermatologist?
Yeah, both of those products are available over the counter. There are prescription products that have azelaic acid in it at higher percentages, but you can get both kojic and azelaic acid over the counter, and they're both relatively gentle and safe. Other acids.
Okay, we'll put a bunch of links for all these in the show notes so everybody can check them out.
Other acids like glycolic acid and salicylic acid can help with pigment because of exfoliation on the skin. And then a product that you will sometimes see in over-the-counter products is hydroquinone. And it is a 4% above as a prescription product, but it is a true bleaching agent that we sometimes write prescriptions for in compounded fashion to lighten melasma and dark pigment. But it is one you have to be careful with. There's some nuances with using it because long-term use can actually result in a different kind of increased pigment on the skin, which is counteractive to what we're trying to do. But again, you're really super safe with things like kojic acid and azelaic acid as ways to help lighten dark spots on the skin. And actually, Eucerin has a new skincare line that includes, I forget the active ingredient, but they have a sunscreen, a night cream, and a serum that are intended for dark spot correction. And it's a pretty nice, affordable product line for patients.
Okay. Now, I want to pivot slightly to a question that is on my mind. We talk a lot about perimenopause and menopause in our 40s. Is there something that happens to the skin too during those times that we should be aware of, or something that we could maybe start doing to prevent whatever might be coming our way with aging nightmare situation?
Well, I think as people get into perimenopause and menopause, we're losing sex hormones. So both testosterone and estrogen have tremendous effect on hair, skin, nails, etc. So we see less oil or sebum production within the skin. So people will notice those changes. So you tend to need heavier moisturizers after menopause. You have less trouble with acne, but more trouble with dryness. There's a lot right now talking about topical estrogen use. And I think that it's not harmful, but I don't know that there's great evidence out that this is something that's tremendously helpful for women. So again, not hurting yourself, but maybe don't need to spend the money just yet. Jury's out. Hormone supplementation, hormone replacement therapy. I think people will notice tremendous improvements in skin, hair, and nails. So from our perspective, the hormone replacement in the right candidate can have some benefits.
Love that.
What about, I'm like obsessed with pimple patches. I'm like, where were these when I was a teenager?
Yeah.
Do you like these? Are these? I mean, I just feel like it makes me not pick then because it's
Love
kind
pimple
of
patches. I love them for
okay.
adults. I love
Sweet.
them for
Oh, good.
teenagers. I think they're essentially hydrocolloid dressings, but they're shaped like a little circle to fit on a pimple. But you can buy them for wounds and bandages. We've been using these for decades for wound management in dermatology and other fields of medicine. So they keep kids from picking at things, which can reduce scarring, improve healing time. They prevent dry scabs from forming. So I encourage use for both my teenage patients and adults. You can't go wrong with them.
Okay, I have a couple questions on at-home devices because now you can, every influencer is a dermatologist, right? Like they're
Mhm.
getting all this advice from everywhere, and a lot of it isn't factual.
sitting
So I would like, yeah, I
creating
would like to
TikToks.
know
Uh-huh.
exactly what actual at-home devices work.
Mhm.
So red light therapy, mask, those are everywhere. I really want one. I don't have one yet. What do you think about that?
Well, I don't have one, if that tells you anything. So
Okay.
yeah.
Okay.
So we use red and blue light, which are visible wavelengths in dermatology to treat precancerous spots. So something called photodynamic therapy, but it's in conjunction with a light activated medication. There's some thought that, and some evidence that blue and red light reduce P. acnes on the skin. So there probably is some validity to improving acne, although we know that bacteria presence is not the only cause of acne. There's a lot of other reasons for it. Anti-aging, your benefit is going to be minimal. I don't think this is a super impactful treatment. Again, this is one where I don't discourage my patients because they're not hurting themselves in any way. But I'm not sure buying a device that's several $100s that's going to give you minimal impact. You're going to get better impact from sun protection, retinol, and things like Botox and fillers than you are from red light. Yeah.
Okay, what about all the scraping tools like
was
the
just gonna say
gua
that.
sha or like just even the rollers? Like Ann and I both have bags, so we are like ice
have my
rolling our
gua sha.
face. Like
She's going.
I feel nervous. I feel nervous to do the gua sha because I feel like it's going to make my skin saggier. I don't know. This is not backed in science. Give us some evidence here.
Again, you're not going to hurt
about these
yourself,
rolling
and I'm
tools?
not sure how much help you're doing. These go into like concepts of
Okay.
lymphatic drainage, right? So
Yes.
Yes.
feels good. If it looks better afterwards, fine, do it. But you're not fixing or changing anything structurally.
I'm not
Damn
going
it.
to make
I
my
was
skin
hoping to-
saggier.
No.
Okay.
I was hoping it would give me a chin. I keep like scraping
pull
that
it
thing
forward.
so tight. Yeah, exactly. It really can get aggressive with that gua sha.
I already grilled Lori yesterday. I'll just give a behind the scenes, but I'm like, Lori, how do I get rid of the jowls? Tell me. Fix me. What
was
laser do I need? She said, you need a lower facelift. It's the only thing that would do
Oh,
it. And I was
no.
like, God damn it.
Yeah, I really
Okay.
like
Top but
microneedling.
fair.
I think that's a pretty non-invasive thing to do. Heals pretty quickly, and is offered pretty broadly.
What does that do?
Microneedling. So think about it as like aerating your lawn, but you're like aerating your face with little needles. So you're creating
okay.
micro injuries that heal and recover pretty quickly. So it's like a weekend of
Even for
downtime.
sensitive skin, I like worry that would just jack me up.
It could set you off. It could set you off for a few days, but you're also going to get some longer term benefit from doing it. And settings can be adjusted. I have a couple of my physician assistants in my office do a lot of the microneedling. I'll do more intense cases for acne scarring or some really bad facial rhyetids, but it's a pretty easy, safe procedure to do.
And I think I already know the answer to this because I've seen the horrors of having an at-home one, but they have at-home microneedling. That seems so wrong because it seems
well, I think
like you need a professional to do that.
I think those are potentially helpful, but you like at home, people don't have the same anesthetic agents, the same potency, so they can't do the same depth or density that what we can do in the office. But
Okay.
there probably is some benefit to even some of these home devices. Just it's always deeper, better, more in a clinical setting.
Okay,
Yeah.
what about we're all obsessed with eye patches, right? Is this just cooling it off or do these work? What's going on with these eye patch craze?
Yeah, I mean, I think you're reducing some of the inflammation or edema that's there. Just like if you sprain your ankle and ice it, you notice the swelling goes down, but the next day it might be back. Same thing with your eyes. You're probably helping reduce the appearance of fine lines and wrinkles. It's hydrating the skin. They work a little like hydrocolloid dressing. They're just kind of holding moisture in place. And again, reducing some of the puffiness that's there, but you're probably not going to see, substantial long-term benefits from using them, but day to day, they're helpful.
And I'm assuming same with ice rolling. It's just depuffing basically. Okay.
Which is good. Maybe we have an event that day.
Yeah.
But or if you just wake up looking like this, I should have ice rolled
Well, that's
this
the
morning.
next thing. So I did wake up. Kate and I were both laughing as we have the one episode on skincare to this degree. We both woke up with puffy eyes. I was like, cool. But I usually don't have puffy eyelids, but now all of a sudden I have them the last 2 days. And I don't know if it's just allergies or what. Is there anything to help that? Or is it just eventually I have to get that eyelid surgery that everybody's getting where you just lift it?
I mean, I think there's a lot of genetics that contribute to this, right? So long term, we end up looking at our parents no matter how much we don't want to. But and environmental things, you mentioned allergies, thyroid disease, hydration status. So they can all affect swelling around the eyes. And if you're controlling all the factors that you can, there's probably not much else to do.
I do love the idea, though. I always see the people who wake up at those 5 a.m. club people, and then they put their face in ice to start their day. It something about it makes me want to join them, but I don't think it does anything.
No, Ann, no. I also asked Lori, I said, okay, my bags are bagging. I feel like in the last couple years, plus 40, I'll be turning 44 this year, but I was like, my bags look worse than ever. What can I do? And what did you say, Lori?
I said, you'll probably need surgery eventually.
Yeah, there's nothing you can do. Nothing.
We do a lot of things like Botox around the eyes, and we add fillers around the cheek, and it can minimize those appearances. But we all have little pillows under our eyes, little fat pads that cushion the globe of the eye, and they have a tendency to settle and herniate as we get older. And the only way to get them to go back where they are is to make them go there. And so you'll see your friendly local plastic surgeon for that option.
I'll give it some more time. I got to save some things.
we both get Botox. I really enjoy it, but I don't do it too much. I'm almost too nervous to get it too much. So what's kind of your entry into Botox, if you will? I've done a little bit around the eyes and in the middle section, but not my forehead yet. Are you just, find someone you love and get Botox, have them help you no matter what it is?
I think it's super important to have someone that understands what your goals are, and will gradually introduce you into this is what to expect. This is what I recommend. So when I get a brand new patient that's never had toxin, between the eyes is usually the first place that I'll recommend toxin, because it gets rid of those little 11 creases. It gives a little bit of lift to the brow, which most of us are worried about our brows getting droopy. And then you can add in other areas of toxin. So around the crow's feet, across the forehead. I actually don't tend to tox my forehead very much because I like to keep my brows as elevated as possible, so I get a few forehead wrinkles. I do often recommend that people are very careful getting Botox from someone who's not adequately trained in the lower part of the face, because that's an area that can really affect the way your mouth moves, your facial symmetry. So those are areas where we like to make sure we have someone very well trained in toxin usage before you let anyone inject below your eyes.
What about this lip flip? I've been told it might help my gummy smile if I lip flip, and I was I've been thinking about it. What do you think?
So lip flip is actually different from gummy smile. So when we inject right above the border of the lip, it actually helps roll the pink of the lip up and out a little bit. When we want to drop the lip for a gummy smile, we're actually going to a different muscle right outside of the nose. But they're both really easy areas to tox, and they only take a few units. So again, relatively inexpensive and pretty impactful for our patients. But lip flip is super popular. Lip filler can be uncomfortable. It's probably one of the more painful areas to have filler put. And so I have people who are I want my lips to look a little more prominent without having to do lots of injections or make my lips look larger. Everyone's anatomy is a little different. So lip flip in one patient may look more robust. So you might see more lip. I've done a lip flip on myself and I don't notice a huge difference. So again, every patient's a little different, but it's a very easy place to put toxin, and patients come back for it every week.
I do get a little worried about the lips though, because again, I haven't had it. And then you see the horse race, you see the housewife version. And so it's like, I know there's a lot of in between, but I do get worried to start the lips.
I feel like I can tell when people have had filler.
Filler is different than toxin. I think a lip flip with toxin is very subtle, and
it's like your starter
wears
package.
off in a couple months, and you're like, no harm, no foul, right? If you don't like
that's kind of like, for me, it feels lower risk because it's like I can try it.
Yeah. Okay. All right. And going back to just the skincare of it all quickly, do you suggest the exact same things for men as they age? Is it just they should be doing the exact same things no matter?
They really should be doing essentially the same type of stuff. Simplistic routines work better. Men don't want to put 7 products on during the day. So, sunscreen, retinol, hydration, and maybe a little vitamin C if they're up for another step. But I think men struggle a little more with sun protection. They don't tend to wear makeup, and makeup innately, even if it's not labeled with sunscreen, probably has a little bit of protective value to it. They also don't have hair. So we see a lot of skin cancers on the tops of ears, backs of neck. And so they need to be a little more cognizant of either sunscreen or, brimmed hats. They like to wear baseball caps, which cover almost nothing but their forehead.
I can't even get Chris to use soap on his face. He doesn't even wash his face. I can't believe it. And he's got great skin. And I'm just like,
you should probably not use body wash as your face wash either. So pick an actual facial wash.
Okay.
And gently encourage one thing at a time.
One more thing, because I'd like to move into the kids section, but collagen. What's your take on collagen? Like liquid collagen, all of it.
So collagen is a bit controversial. A lot of people use it and like it. And even in our dermatology world, we have the naysayers of this isn't doing anything for you. And you have those that swear by it. The consensus, I think, for most of us that are pretty moderate is there is some evidence that collagen can help the appearance of your hair, skin, and nails while you are using it. Probably a benefit that goes away when you discontinue. Personally, I've tried collagen. I can't stand the way it tastes. Even the flavorless ones, I can tell it's in there. So I don't use it as a supplement, but I don't discourage my patients from using it if they're seeing good benefit. I think it's safe to use, and they can continue to use it if they're seeing some improvement.
Okay, what about thinning hair? We got to go here because we hear this a lot. I'm going through it. I tried to take Nutrafol and couldn't stand the horse pills. Now I just do like a biotin gummy, like a Vegamore gummy. I also started doing a little bit of, what's it, Rogaine, but like the real name? That's it. But I kind of forget, but I use it every once in a while. I don't know. What else? Is this correct? What else can I be doing?
Probably isn't working, used occasionally. It has to be pretty regular use. So there's one of your problems.
It makes my hair greasy. Is there any fix for that?
Yeah. Well, there are multiple formulations. There's foams, liquids, shampoos, and we even prescribe oral minoxidil now. It's thought to be safe and effective for patients. So that helps a lot. I'm seeing a lot more hair loss now, especially since introduction of the GLP-1s, because we see a lot of people with weight loss. And weight loss is probably the primary trigger that I see for...
Maybe that's what's going on with me.
So GLP-1s, thyroid disease is another thing that's very common in middle-aged women. So if you're having trouble with your hair and haven't had your thyroid screened, I think that's super important to get in with your primary care doctor. For those of us avoiding the sun religiously, vitamin D deficiency is relatively common, especially in Caucasian populations at more northern altitudes. We're just not getting the sun we need to maintain our vitamin D. So that can be easily supplemented on a daily basis.
With just like oral vitamin D supplement, you mean?
Yep. Couple thousand international units is adequate for most people, but if you haven't had a level checked, it's probably important to do that as well. But we do oral minoxidil. Biotin can be helpful, but it can actually affect your blood work when you should get your thyroid checked. So you should let your primary care doctor know that you're on that, and they may have you discontinue that before they check your TSH and T4.
Which is what?
Your thyroid labs.
Thyroid stuff.
Yeah.
Okay, I like the idea of an oral
Mm-hmm.
minoxidil.
Mm-hmm.
Okay, I'm gonna
Yeah,
try
and
that.
we're using
Anything else for GLP-1 hair loss?
weight stabilization. Once weight is stable, 6 to 12 months, you'll stop seeing hair loss. So the hair loss we see
okay.
after weight it's usually like after you have a baby. So it's usually 6
Mhm.
months ish after you've lost the weight. It tends to last for 3 to 6 months, and then it will regrow. What happens is that your hair shifts from growth phase to rest phase, and it stays in rest phase for about 6 months, and then it falls out. And so then you got to wait for all the new stuff to grow back in, which is why it's painstakingly slow. You just see a shift in the percentage of that hair growth. And what minoxidil, both topically and orally, does is it promotes the anagen or growth phase of the hair. So it shifts hair back into growth phase. For those of you with long hair, it takes a while to notice that difference because the fullness takes some time to grow back in.
Ain't that something? You lose weight, you start looking good, you lose your hair. It's like,
Yep.
come on, people.
you can't
It's a
win.
bitch slap right when you don't want to. Kick you when you're down.
We're
Or actually
trying,
kick
but
you
it's
when you're
hard.
up. You can't
Yeah.
get too high or we'll
Can't
pump you
get
back
too
up.
high. Slice you down.
Okay, let's move
so-
into the parenting side of it.
Yes.
Is that okay?
That's where I was going to go.
All right. So I think all of us have young girls, preteen girls. Grace is wanting a vanity for her birthday. I have even like kept her away from YouTube. I'm like, where the F is this cultural pressure coming from? She just notices things, but she wants, she wants to move into Sephora girl phase, which is a little bit painful, but I'm also trying not to make a big deal out of it. But like, what are the skincare routines a 10, 11, 12-year-old should do that's not going to hurt her, that's like fine?
Yeah. So I have my daughter will be 9 this year, has vanity in her room, loves the skincare stuff. And she wanted to go to Sephora for her birthday, and so we took her there, and she's buying skincare products, and she comes running over with this product. I think they're Drunk Elephant, and it's like $125 product I'm looking at, and it's like a night retinol, like a radical age cream or something. I'm like, girl, you're not getting this. So, there are skincare lines too that are catered towards this age group. So simple things like moisturizer, face washes. They can do simple hydrating masks. We just want to avoid. We don't want them using glycolic acid. We don't want them using retinol. We don't want them using
vitamin C.
Vitamin C is probably okay, but if we remember, ascorbic acid is an acid, so it can be a little harsher than maybe, their young skin doesn't have any oil yet, no sebum, so you can potentially cause some eczema-like changes or irritation pretty easily or dry their skin out. So again, you're better off sticking with just hydrating products, gentle cleansers, those type of things.
Do you have a good moisturizer for a preteen girl?
Rosie has she has like Bioma products, and she has Bubble, I think, are the skincare products that she seems to like that work well. And they're colorful products.
Yes, I've seen Bubble.
Yeah.
They're cute.
Yeah, it's cute stuff. Okay. It's cute stuff. And she really likes that. And she'll even use, I'll pull some of my skincare products that I know are just, again, simple moisturizers for more sensitive type of skin. She still is in an age where like she gets face wash in her eyes, so I try to like not give her anything that's gonna like sting or burn, so she absolutely cannot use my face wash. And we're running screaming out of the shower with a washcloth over our face. It's bad news for the rest of us all night long.
What about if you have a preteen already starting to get acne? Yeah. What do you do in that situation?
So 2 things I have parents start with over the counter before they even need a visit to the dermatologist. One is benzoyl peroxide face wash. So benzoyl peroxide is in like Clean and Clear, Panoxyl. There's a variety of over-the-counter benzoyl peroxide washes. You can get it also in like those little like scrubby pads. You can get it on as a leave.
Benzoyl peroxide though,
so it can be irritating. So it really is meant for oily, acne-prone skin, but it kills most of the bacteria on the skin that causes acne. So it's a good way to start if your skin can tolerate it. So we do have people like Kate, or I have others, some sensitive teens that can't do it. But it is available in anywhere from a 4 to a 10% wash. and those can be helpful. I like wash off products because benzoyl peroxide can bleach things. So clothes, towels, even like eyebrows, if they're scrubbed too hard with benzoyl peroxide, can kind of lighten in color. So you do have to be a little careful. And then adapalene, which we talked a little bit earlier when we were talking about retinols and retinoids.
Mhm.
So it is a retinoid, helps unclog what we call our comedones, which are, the blackheads or the precursor lesions for acne, and really should be started, again, used gently once or twice a week on oily prone areas. So a lot of kids will start like nose, forehead, chin, that T-zone of acne, and that can be helpful to prevent some of these smaller acne lesions from becoming larger, more inflammatory lesions, nodules, cysts, scars, those kind of things. But once a kid starts getting more, then it's probably time to head into the dermatologist.
Okay. And I have a very fair-skinned baby,
Mhm.
almost a redhead, and he is 9, but I already took my 2 older ones to the dermatologist just to start skin mapping because I see they both have freckles, and I'm protecting them as much as I can, but he still is in the sun with sports, so I'm worried.
Mhm.
Is that too young? What age do you say start going to the dermatologist, or what else can you do for a very fair baby?
Yeah, it's a great question. So I do sometimes get kiddos come in, especially kids of parents who have had melanoma or have lost a family member to a skin cancer or had, kind of some scares within the family. I see kids with unusual nevi, which is our word for moles, often. But most pediatric patients don't need skin exams. We see most melanoma evolve in the later teenage years, would be the youngest we tend to see it. There are a few types of rare moles that we see where kids will get melanoma under the age of 5, but those are unique and rare circumstances. So most kids don't need skin exams. The pediatricians are pretty well versed on this is normal, this isn't normal. Okay, I'm going to send you to see, you have tons of abnormal moles. Let's get the dermatologist to weigh in on this. But, guidelines really don't even suggest that most adults need routine skin exams without a history or a concern. So I think that's a hard answer to question. It's never wrong to come in and get those checked because we do sometimes find things that need monitored. But I think a parent, especially if they have a kid that has a couple moles that are unusual or irregular, you can take a photo of them, watch them yourself. So most of these moles we're looking for that are changing, growing, if they're symptomatic, so they're bleeding or they're itchy or they're scabby, those would be reasons that we really need to have a look. But it's normal for kids to get moles as they get older. So all the way up to about age 30, we'll see kids, teenagers, young adults getting new nevi. And unless they give us some reason to be suspicious, we usually don't remove them and we just monitor.
Okay, enough about the kids. I want to go back to myself. What about, I've noticed as I've started aging, in addition to just a lot of spots and freckles, I'm getting like little red freckles for the first time. What's that? Is that just normal aging freckles?
Yeah, so red freckles are what we call cherry angiomas, and they are very common. Most adults will get a few of them, and some will get more. Again, a genetic predilection is why we see more of these in some patients. They are harmless, never turn to skin cancer, and can be pretty easily treated with a vascular laser. So depending on how much they bother you, they're pretty simple to treat.
What about other sunspots, like little, brown spots I'm starting to notice? Is that also, I can laser those off?
Can often be lasered. They have a tendency to recur more. So especially kind of spotty brown. I'll also see people come in with little white spots all over and they ask, what are these? So the way I explain them is they're areas where your skin has gotten exposed to the sun enough that it's tired of making pigment. So it's essentially a loss of pigment related to
It gave up. I'm out.
Yeah.
I'm like, ooh.
So you either get too much in one place and not enough in the other.
I have a bunch. My skin's just like, and I'm out.
And we remember that sun damage is decades delayed. So like, this is probably not the sun you got 2 weeks ago playing tennis. This is sun that you got decades ago laying in a tanning bed at Ball State. So
with you, by the way.
Absolutely.
Absolutely. Where was this advice when I needed it 20 years ago?
Yeah, the 43-year-old dermatologist used to lay in the tanning bed and had a sister with melanoma, but yeah, I could
Listen, that's
Yikes.
relatable though. That's like what we all did when we were
Yeah.
young and dumb, and
Yeah.
Here
Anne's
we
literal
are.
name was Tania. Does that just make you want to? That
Yeah,
makes
Lori-
Lori
Well,
want to
you
die.
were
Lori
the
does
only
not
one with
approve.
a car freshman year at Ball State, so we'd literally all pile in so that we could go use the tanning bed like multiple days
Oh
a
my God,
week.
hilarious.
I'm mortified how we used to cook our skin. I know I'm
Yeah.
paying for it.
That was everyone.
Yeah.
Okay, last question on bumps. What about those like calcium bumps or whatever? Like the little white
ones.
bumps that can appear around your eyes.
Yeah. So they're called
Can you
milia.
remove those?
You can easily remove
Okay.
those. So what I tell
Okay.
people though is they are not pimples. They don't have an opening to the surface, and so you actually have to either nick or open the skin over top of them to remove them. So retinol thins the skin over top of them. So if you can use some retinol without irritating your skin over top of those, it does make them easier to extract. But they're harmless, and they tend to occur in areas of friction, so which is part of why they form around the eyes. But kids can get them too. But again, harmless, and they usually don't go away on their own. So
Okay.
Go to a dermatologist
last time I went to the dermatologist, and again, I wish I was closer to you, Lori. I would love to. I'm going to switch and just drive to you, even though it's hours away.
drives.
But it was just like, what's this? Yeah, exactly. They were like, what's this? Aging. What's this? Aging. It was just like, okay. Like I walked out of there going like, well, it was all aging, nothing serious. But what can I do about this?
Give up.
Find the fountain.
I'm out. My skin's out. Okay, cool. Well, Kate, do you have anything else before?
Any other like lasers? I don't know. I feel like certain women are aging better than others, and I'm sort of like, what other? Are you doing just tons of aesthetics? What are you doing? Maybe it's just genetics, but like, are there other laser treatments or things I need to be considering here to try to age as good as I can?
I mean, I think there's a couple things that I really love to do for patients because they're impactful. One, I don't know if either of you have noticed, starting to get like little red vessels around the corners of your nose. Super common. We call them alar telangiectasias. But basically around the cartilage of the nose, you see dilated vessels, or even in the central part of the cheek. And again, vascular laser is a really easy, simple, relatively inexpensive way to get rid of that. And it just smooths your skin tone. You don't flush as much. That redness, you don't have to cover it with makeup. So that's a pretty easy, simple thing to do. The other thing I love to do for my patients are either chemical peels or laser resurfacing. So essentially just kind of like taking off the dead top layer and allowing new skin to come in. So any injury to the skin allows it to rejuvenate in a glowing way, right? Brand new skin just tends to look better than older skin. So I use Jesner's peels, TCA or trichloroacetic acid peels, and then I have a CA2 or carbon dioxide laser that takes those top layers of skin off for people. So prices are really ranging. Peels tend to be cheaper than laser, but again, these are things that can be planned ahead, done, maybe in January when you've got some downtime, and really help kind of undo some of the damage that we did decades ago when we didn't know better.
And the recovery on that, because I've seen people after a peel or something, and you're like, whoa, what happened? Wouldn't have gone out to get coffee today. But like, they're so good, but I still fear like, yes, when in my life can I do that and then not see a bunch of people? So what's the recovery time after?
Yeah. So with peels, it depends on depth of the peel. So the deeper the peel, the better the result you'll get, but the longer the downtime. So anywhere from 3 days to 10 days, sometimes even 14 if it's super deep. And when I say downtime, most people feel great. They can do whatever they want. But you're going to go to the grocery store and people are going to like, whoa, what'd that person do? Right?
Yeah.
Red,
just
healing skin. You'll have Vaseline on with no makeup. So it can be challenging, especially for people who are in front of people or you also can't be outside. So sun is really bad post-procedure for skin healing. So you have to find a couple of weeks where you're not going to be on vacation or outside by the pool. But things like vascular laser, I was talking about, a couple days, and I mean, sometimes even 0 days, depending on the extent of the vessels on the face. So you can plan ahead, and most people can find some time. I love to work out. So when I CO2 laser my face, I'll work out, go have my face lasered, maybe take 1 day off, and then I'm already back to the gym the next day. And I get a few stares, but
nothing crazy.
What about Anne's dry lips?
Oh, yes. Oh, I forgot to ask about that. There's
You're
chronic
welcome.
dry lips. Yeah.
Yeah.
Help.
Well, I think again, a lot of my go-to for people is there's a lot of weird stuff in lip products. So, for instance, Burt's Bees has propolis in it, which is a common allergen that we see, and so people will be obsessed with using Burt's Bees, and then their lips never feel good, and they don't even ever realize they have a propolis allergy. Plain Vaseline is great. They also make some skin salves or lip salves that have hydrocortisone in them. So like Cortibalm or Dr. Dan's, they have a little hydrocortisone. So for people who tend to have really easily irritated lips, when you are having a bad week, using those for a few days can really be helpful.
Okay.
But again, avoiding like a bunch of the crazy fragrance additive skincare products on the lips, because they can be just as sensitive as other places in the body.
Okay.
Right.
I liked how we said we were going to keep it 20, 30 minutes. We're at 55
so
minutes. We better wrap this puppy
We
up.
better wrap it up. Okay.
We need to do a recurring segment is what I'm hearing.
Yeah.
I'm in for it. You guys make another list of questions and I'll join you.
Okay. We'll be there. We'll take listener questions next time and do a follow-up. So if you're out there and we didn't get to your question, just DM us at Sage Sisters Podcast on Instagram. And
I'm also going to steal Dr. Lori for a little bit after this to do a quick viral clips for like the trending things, rate them between 1 and 10.
no one cares about your marketing.
Yes, they do, because I love
Well, they'll like it, but we don't even.
Exactly. No,
Anne's always talking about her list for the list. It's like, well, just do it. Just quit talking about
I just meant if you're interested in those ratings, go to Sage Sisters Podcast. Thanks, Kate.
All right. All right, Laura. Thank you so much for being with us. I learned a ton. Even though I have you, I still learned a ton. So that was great. I'll be seeing you in your office for some Botox very soon.
Couple weeks.
All right. Love you, girl. Bye. Okay, that was fun. We're definitely going to have to do a recurring segment with Dr.
We
Lori.
had so many more questions to ask her. Like I literally got through half of my questions, and I was writing more down as she was talking.
Mm-hmm.
So the list was getting very long. I loved it. But how informative. I feel like I know way more. And I also really appreciate someone who can talk to me about what I actually need to spend money on or not. Like that is such a crucial part of the skincare process. Is everything costs a lot of money. So we always say you're not ugly, you're just poor. So it's like it's really really nice to have someone.
Well, and you feel like if you go into your local dermatologist, they make money selling you all this stuff. It's kind of nice to have someone you trust give it to you straight, so you can go in there a little more educated about what's worth the money.
Or just like honestly, your bags are gonna bag. It's like oof. But it's also like great. I'm not gonna waste a ton of money trying to do things that aren't gonna work.
I know. Tough but fair, but thank you.
Exactly.
Cut it to me straight. I'm gonna need a lower facelift and a lower bluff at some point. Got it. Tough but fair.
I should save my money now for what's actually going to work. Okay.
And there's nothing I can do, people. If you see me with bags, just know that. I'm doing everything I can.
All right. Well, let's pivot to our tech tip then.
Okay. There was a new global study tied to the World Happiness Report 2026. This is not new if you're a longtime listener here, but once again, new research tying popular social media sites, TikTok, Instagram, to poor mental health outcomes, especially for young people. So the report found that anytime there's an algorithmic feed, influencer content, and shorts, so that was kind of like the three things, there was a huge negative impact on how people felt compared to how people felt on like communication type apps. And they actually studied them against each other. So I would just say tech tip here, be really cognizant of both how you feel after being on those apps and also what access you give your kids to that sort of, really it's the doom scrolling,
right,
influencer content kind of stuff. So turn off shorts in YouTube, try to delay any platform with shorts like Snapchat, TikTok, Instagram, as long as you can. And then, talk to your kid about this. Talk to your kid about the science. Talk to him about the dopamine. See if you can build healthy tech habits when they are ready. Try to really increase the consciousness about this, because ultimately we want to have happy kids and it doesn't help.
Yep. Okay,
Cool.
great one.
All right. What's your obsession?
Let's move to it. So my obsession is, I'm always talking about healthy snacks for the kids, different brands I like, things I'm making. But there are 2 local moms here in Nashville that have started a company and they ship nationwide, but it is Better Snacks. So it's essentially Thrive Market, but like to me, it has more backing because they're hand picking everything. And you can go and select the different snacks for your kids and then they ship it to you. So I've been they just launched last week and I already got my first shipment and I already placed in second order. But
I'm excited about this.
It's just, and it's a little bit cheaper. So the snacks can tend to get expensive. And depending on what you select, there is price range differences. But I'm finding that these snacks are heartier and I can book like 10 to 12 at a time for whatever the snack is. So they had these kind of like almost rice cake type chips for the kids and they love them. And I can get 10 or 12 at a time. So I have a couple, 2 weeks worth of lunch snacks for the kids. And
mine are also just sick of what we've been doing.
Yes.
Like, I love the idea that it's almost like I can mix it up a little bit easier.
Well, and they're doing like taste tests. So they had like a whole focus group. And so they're picking things that taste really good. And so everything that we've gotten, my kids have liked. They have these dried strawberries that my kids love. They have these meat sticks that we've never tried before, but they taste great. They're like chicken and maple. And the kids are loving them. So anyways, Better Snacks, we'll link it in here. Again, they're shipping nationwide.
Love 2 moms starting companies.
This is it.
Boom,
I also
baby.
love that story. So support them. They are hand selecting these snacks. You can go to their website and create your own box.
Awesome. I'll do that right after this. My kids will be pumped.
All right. What's your obsession?
Okay. Do you remember my favorite book of 2025? Project Hail Mary.
I was like,
I love the whole, put you on the spot there in an awkward way. I haven't been excited to watch a movie like this in a while, but the movie came out this weekend and we went yesterday.
Oh, how was it?
Obsessed.
Oh, really?
It was so
Okay,
good. It was everything I wanted. I was very nervous. I don't think this is a spoiler because it's literally in the trailer, but there's an alien in the book. He makes friends with an alien. And I was like so nervous about how they were going to portray this alien. Knocked it out of the park. So good. Ryan Gosling, just freaking give him all the awards. I don't care. It's so good. So believable. I forgot he was Ryan Gosling. I'm just like.
Well, and kid friendly because Ace loves this story. Phil read the book. We've been talking about the storyline. He really wants to see it. Okay for kids?
I would say here's where I showed Grace and Nolan, who are both 10 and 11, the trailer, and they ended up picking Hoppers because there was 2 movies.
They went different.
Cal, I knew was not going to make it. So Chris, I love him, but he was like, I'll take the kids to the Hoppers movie at the same time that you guys go to Project Hail Mary.
So you got fired up from an adult standpoint. Kids.
Yes. But Warren, who's 13, or is he 14? Sorry, Warren. I think he's about to turn 14. He loved it. So I would say if you have a 12, 13, 14, there's nothing bad in it. It's just a little bit perilous because, Earth is dying as the sun dims. And that's a little bit of a scary premise. So I would say that's the kind of almost stress of it. It's more just high level perilous danger, not anything. I didn't even notice any bad language. Certainly there's no sexual stuff. So to me, it was fine for kids if they could handle that storyline.
Okay. Now, side note, Hoppers.
Yeah.
What's the Hoppers review? Because I also have that on our list to see.
They all loved it.
Good.
All of them said it was really cute.
Good.
Do you know the premise of it?
Not
I just
really,
learned
to
it
be
and I thought it was it's basically Avatar, where there's sort of they go into the machine and then become the blue avatar.
Yes.
Except it's scientists going into the machine to become a little beaver to get to know the animal world. And then
that's cute.
It's basically this young female scientist becomes a beaver and they said it was adorable and funny.
Okay, cute. I did not know the premise and good. I'll take the kids. Wave it in.
Yeah. I think it sounds like a winner. But also you have to see this. It's a great movie theater movie too because it's big and cinematic with all the space.
I can't wait. And Phil's really excited to go to Project Hail Mary. So we will see this very soon.
This movie has 97% on Rotten Tomatoes from the audience and 94 from the critics. Blockbuster, baby.
Okay.
But this might become my whole personality this week. I won't be able to start yapping about it.
Right,
I
right.
immediately started texting people as soon as I got out of there
Yeah.
because I was just like, because I shared the book with so many people, but I was like, you have to go watch this movie.
Yeah. Well, you were so excited to see the movie, and I was like, I don't think I need to go opening weekend. But now the energy is maybe I should have. Maybe I missed out.
It was also like sold out, and there was like a gajillion shows. This is going to be a big
Okay.
one. So make sure you get tickets ahead of time or you won't get seats.
Okay. Great.
But very fun. I'm obsessed. Go watch this movie.
All right. Well, that's a wrap on today. That was a fun one. I'm excited.
Very fun.
Oh,
All right.
and
Love you, Tan.
follow us.
I love.
We're so bad at that.
We gotta start the show with do these things. Whatever.
Rate us.
All right.
Follow us.
Love you all.
Love you all. Lilas.
Lilas.